I'm Carl Price, MD. I did my medical school at the University of Texas in Galveston. I did a complete general surgery residency at the University of Oklahoma. And then I did my plastic surgery training at Emory University in Atlanta. While in my training, I did quite a bit of research and actually developed some new surgical techniques at Emory University and have spent many years teaching people how to do those particular procedures, specifically endoscopic breast augmentation, all over the world. In our plastic surgery practice, we try to make sure that we individualize our treatments for everyone who comes in. Everybody is different. Everybody needs something different, whether it's a reconstructive procedure that we're doing after mastectomy, reconstruction of breast after mastectomy, or cleft lip, cleft palate, or the cosmetic procedures we do. Everybody has different needs. Everybody has different problems that need to be addressed. And so we try to make sure that we're doing that on a very individual basis, using the most up-to-date techniques, making sure that everything that we do is as good as it can be. One of the wonderful things about being a plastic surgeon is that you're generally making people better, and that you're kind of the happy doctor. No matter what situation you're in, you're the one who's coming in and making things better. Whether it's after cancer surgery, you're giving them something back, reconstructing them. If it's a cleft lip and palate, you're creating, you're making a bad situation or making something that is unhappy happy. Even with our cosmetic procedures, we're generally making people better. We're addressing things that have bothered them for many years in some instances, and really having a positive impact on people's lives. Plastic surgery is wonderful. First of all, we're the last of the true general surgeons. We operate cradle to grave, head to toe, and many things that we do, as I've mentioned, not everything is the same. So every day is a new day. Everything that we do is a little bit different, and there's a bit of an artistic bent to it too. And so that's very challenging, but also very rewarding. I chose Springfield because, strangely enough, I did my undergraduate at the University of Texas in Austin. And Springfield reminded me of Austin when I was in school in the 70s. It's a college town. It's aesthetically very, very nice town. The people are wonderful. It's easy to live in Springfield, and it was a wonderful place to raise my children. I chose Cox Health because I was so impressed with the quality of the medical staff. I trained at arguably the best plastic surgery program in the world, and got to work with some outstanding individuals. And when I came to Cox Health and I saw the overall quality of the medical staff, it was refreshing, frankly. There aren't a lot of communities where you can kind of sort of go to almost anybody and they're really pretty good. Well, I have a totally irrational hobby for a 63-year-old surgeon. I race motorcycles, and professionally. And actually, I'm going to be racing in Italy this year. I truly enjoy community activities. I've been involved in a lot of different things in the community. I was one of the founding members of Breast Cancer Foundation of the Ozarks. I was on the board of Ozark Public TV when we actually transitioned from being quasi-independent to part of MSU. I was on the Arts Council. I was actually president of the Arts Council, kind of making sure that there's a richness in our community that you don't find in communities the size of Springfield.